I gave a much longer workshop that addressed this issue about climate change in the Arctic and impact on Indigenous communities. And that talk also included a discussion of Arctic workers. And I do believe that we'll briefly touch on that, but those two communities are where I think we should focus, but especially on Indigenous communities when we're trying to understand the impacts of climate change. It is, in my opinion, a mistake to simply focus on possible impacts on wildlife when in fact the communities of the Indigenous populations, especially in Alaska and the Inuit in Canada, really need much more attention than they've received. So very briefly, I'm going to talk about loss of polar ice, something that everybody knows, but what I really want to do is to draw our attention to the fact that Indigenous populations, Indigenous residents, it's their health effects that we should really be focusing on to try and understand what kinds of epidemiologic impacts are measurable when it comes to climate change. So regardless of the amount of ice melt or warming, humans are going to adapt and then they're going to migrate. And then polar communities are going to react, and they will also preserve themselves and their cultures, and governments have a duty to help mitigate the effects of climate change where they can do so. And as I briefly said, there's been a lot of good PR focusing on wildlife impacts and very little on the threats to human health. And in this talk, I have bits of evidence that I wanted to share with you, but these are much more in the realm of understanding areas where we should be studying rather than where we actually have good data to look at. This is a polar bear. This is the kind of thing that everybody sees and everybody gets a little weepy about, but I have not actually seen evidence that the full polar bear population's health have declined. And the only reason for saying that is that, as I said, good PR gets you lots of monetary investments if you're a wildlife not-for-profit. There's also the loss of a lot of glaciers in the Arctic. And if you look to the next one, you have the actual evidence from September 1979 in terms of what the polar ice looks like compared to September of 2015. And as you can see, there is open water between these two dates, especially in the northern parts of Canada in the Arctic. And that's clearly an indication that the polar regions have warmed rather dramatically. This was something that I came across, which I actually was not aware of. One is that you can see in the light green the Canadian Inuit, but there's also the Greenland Inuit, and there's the Alaskan Inuit on both the east and west sides of Canada. And there's also a Russian Inuit. I did not even in my wildest dreams have I've been aware of the fact that this is sort of part of this community. The other thing that tends to be put up there but not studied very much is the Russian or other Arctic communities that are part of the former Soviet Union and Northern Europe. But these are areas that we should keep in mind when we're studying health effects. So I was very fortunate that I was in Winnipeg, Canada in 2014, and it was there that I really learned something quite important from a health perspective. One is that the Canadian medical schools, such as the universities of Manitoba and Alberta, they have major linkages to the far northern community. And the same is true in Alaska, Norway, Greenland, and Sweden. And having said that, though, there are important advances that have been made with telemedicine. So Arctic patients can be linked via clinics to health providers. And then when the Indigenous community patients need to come, for example, to Winnipeg, they can stay in outpatient units with access to native foods and cultures. And I was on a Fulbright while I was there in 2014, and Fulbright has played a significant role in understanding more about the relationship between the exploration of the Arctic for mining and oil drilling and engineering, health and shipping and all this other kind of stuff has been, and we'll talk a little bit more about that in a second, but Fulbright has enabled me to have my eyes open while I was in Winnipeg, and it also is playing a role, and we'll talk about that a little bit more. This is a diagram that shows a little bit more of how the northern communities are linked with clinics and clinical care in the communities. And if you follow right in the middle, you can see that there is a black line that links to Chivalac, and then the Churchill CHC, which then leads to the Winnipeg Medical School. And that's true in several other parts of Canada and the linkages to the northern communities. I just want to say that because as an outsider, when I first arrived in Winnipeg, I didn't quite understand that. And it was only when it was explained to me fuller that that was the case that I began to understand how these linkages are maintained. The next slide will show a building. This is actually within blocks of where I lived, and it's an Inuit community health center that's tied to the medical school, and patients and their families can come to Winnipeg. They can get, as I said, access to their own native communities and to native medical activities, and they also can have spaces for themselves and their families to speak and to sleep and so on. So we know the polar ice is melting, and we know the Arctic is changing. So what are the health problems, and what do we make of the epidemiology of climate change? And very briefly, what I'm asking about is what are the chronic and possibly acute health impacts of Indigenous communities? I didn't mean to just say adults, but we think about adults because they're a little easier to measure. What about for young people, the psychological health toll of rising Arctic temperatures, especially when villages relocate? And I'll show you a couple of slides just coming up that gives us some examples of that. And lastly is this question, is the health of Arctic adolescents being impacted by changes in climate? And by the extension there, we need to really think critically about those kinds of things moving forward, because I think that's where the potential for prevention programs may have the best payoff, and also, of course, that's going to impact the future community. So here is a photograph of an Alaskan native village that's literally being pushed back into the sea because of rising sea levels. And clearly, what is happening in Inuit communities in Canada and what's happening in Alaska is that many communities that were built close to the shore because of the rising sea levels have to be relocated. If you look at the next slide, please, you'll see another example of that. And the relocation process is one that has quite a bit of strain attached to it, quite a lot of stress involved. And all you need to do, and I think of this in my own context, is do you know that what kind of response you will have if your childhood memories are gone, they're obliterated by the fact that there's rising sea levels, and the place that you grew up, where your parents and grandparents were, is no longer, it doesn't exist any longer. What kind of potential impact might that have? And that's the kind of questions I think we should be asking about. A very brief notation about this Fulbright Arctic Initiative, and I urge people on the call, if they are interested in this, to take a look at this because it is a dynamic undertaking. There's also another thing I want to draw your attention to called the Arctic Circle Assembly, which brings annually, the assembly brings annually to Reykjavik approximately 2,000 participants, social scientists and clinical scientists, and occupational health epidemiologists and so on, to continue to look at these kinds of issues and try to answer, if it's possible, what kinds of health impacts are associated with change and climate change in the Arctic. And those of you who are on the call may actually have more background in this than I do. Nevertheless, I don't want you to think that it's only on the backs of the people in public health that we need to be looking at some of these issues. The question then is, what are the environmental linkages? And I found a couple of references. This one is a bit old, Fergal and Segay from 2006, which gave us a template to think about this. So the health impacts for indigenous environmental exposure could be related to heat and cold-related mortality and morbidity, hunting and traveling, and accidental deaths or severe psychological stress because of the inability to provide wildlife to feed your family, increased risk of skin cancer, eye injuries, and possible immunocompromises because of change in climate. And then what about infections? And I mentioned this adolescent stress, which we'll talk about a little bit more. So here are a couple of things. This is a little bit more up to date from Parkinson and Evengard from 2009. They postulated that there is certainly the likelihood of several infectious diseases that we should consider. First would be foodborne botulinum outbreaks. There's the transmission with beavers of Giardia. There's gastroenteritis from contaminated shellfish. There's mosquito and tick-borne infections, including things like Lyme disease and West Nile. These are all thought to be, much more common in non-Arctic communities, but the outbreaks that they raise concern about are something that I think we should make sure that we try and ask about. And tuberculosis is still a public health issue, and most of the data I see from Canada indicate that public health professionals have identified TB as a serious problem for the Indigenous community. And then the question is, might that be something that could be related to climate change? We don't know, but I think it's a very worthwhile question to think about. So a little bit more about Northern Indigenous Environment. It's more true than other groups in Canada and the U.S. that the Indigenous community's environmental quality and health are closely linked, especially among circumpolar people. Much more extensive focus should be placed on suicide, and that should be also brought up as a significant health indicator. And then the questions by extension here is, who must be involved from these communities to provide leadership to reduce the toll of Native Alaskans and Alaskan Native teen suicides, and by extension, the same thing would be true for Inuit suicides. There are elevated health risks that Alaskan Natives and First Nations Arctic that do have environmental components, and they include things like alcoholism, diabetes, asthma, injury trauma, childhood and maternal health. And this, from my perspective, implies a need for things like corporate mining activities on or near tribal lands, risk communication consistent with cultural and indigenous norms, and then a basic or a better understanding of the close ties to the land and traditional hunting and gathering of food and wildlife to First Nations and Alaskan Natives because of the clear environmental tie. And that would extend, of course, to fishing and hunting, whaling. These are all a part of the Northern Indigenous people, and we should be asking how climate change might be affecting them. Given the subsistence agriculture, what are the levels of contamination of their fish and game? And I think that here's where we, especially our community, should be asking questions about mercury and PCBs in fish and wildlife. And might they change, and might they go up, or might they even go down related to global warming? What are the contaminant levels in river water used by Inuit and First Nations for drinking water? What are the water quality profiles like? And what are the risks for Indigenous kids? And we're going to talk about that a little bit later. There's also been, this past summer in 2019, some things that have really come to my attention that I didn't think were something that we should concern ourselves. But what about air pollution? They had several serious wildfires that, because there's such vast distances in the Great North, led to thousands of hectares of burned grass and scrub and things like that. What happens when you've got a drought in the northern climes? What does this do to pediatric and adult asthma in these communities? And then the question also should be raised about smoking and environmental tobacco smoke for Indigenous adults and kids. What about below standard housing, possible TB and things like that? And there is a reference here to Webster from 2015, who drew my attention to this question. And then I think also, okay, well, we've talked about this, but what kinds of examples have we had for effective community actions that are responsive to polar warming and environmental air pollution concerns? So zoonoses are something that I believe we epidemiologists tend not to think about, but we should really not be so isolated. But in the past, there have been these severe and very long winters in the north, and zoonoses have not really been an issue. But with polar warming, there is a worry about dogs and wildlife and the interaction. For example, helmet transmission, and here's a couple of helmets that have been that I've been made aware of. And there's also a question about sled dog populations, which some of you may know are very, very popular in many northern communities, but they present a significant worry for veterinarians who practice in the north, because the sled dog populations may actually act as a reservoir for some infectious diseases and zoonoses. We should try and take a look at this too. Also, and I know I'm sounding repetitive here, but we should be thinking about the youth, the adolescents for Indigenous communities. We need to have an understanding about the interaction with the natural environment, with wildlife and the sled dogs. These are cultural ties that the children from these communities must be exposed to in order to maintain the culture and to keep the communities alive. We also need to think about the maternal and child health issues, and this is, of course, comes back to a point I made earlier about the vast distances from northern communities, Indigenous communities, and access to healthcare. And then there are these accidental risks and traumatic accidents from snowmobile overturns, possibly the snowmobiles falling through weakened ice, and the kids might be at risk for infectious diseases, and that could be also a worry because of access to appropriate vaccines and what I call poor seroimmunity. And I mentioned the poor housing, indoor heating, and things like that. These are and will continue to be a concern for pediatric asthma. I wanted to share with you something I found. The author is Silviken et al. From 2006. Suicide among the Sami community, also an indigenous community in Norway. And they looked at a large group from 1970 to 98, and they found a significant 27% increase in suicide, approximately equal for males and females. But the thing that really got me was that the suicide rates for young people, ages 15 to 24, for both males and females, produced a SMR of 3.17, comparing the Sami community with all of Norway. So that's another place, and that's quite consistent, by the way, with what we know about adolescents in Alaska, and I believe that's also true for the Inuit in Canada. There is a new study that just came out this year, Banya, 2019. They looked at a study of marginalized northern Norwegian adolescents, teenagers, and what they found in this group were that the highest at-risk group were this disengaged group, the lacking education, and they didn't have employment or training activities, with parents having little education, and they were at higher risk for traumatic injury, for hyperactivity problems, and suicide ideation. And their point for undertaking this study was that there should be more emphasis put forward to support young people who struggle with these mental and physical problems. And I would say, by extension, the same undertakings should be put forward in places like Alaska and in the northern parts of Canada in order to try and sort of reach out to these folks who sort of might lean one way or the other in terms of success or failure. Success being going on to adulthood and becoming contributing members of their communities. The failure would be the potential for suicide, keeping in mind that in many of these communities, they have much greater access to firearms, and hence it's easier to shoot yourself than it is to try and grapple with some of your health problems or some of your social problems. This is something that I really would like us to think a little bit more about, but what are the epidemiology issues that we should be paying attention to measure the impacts of climate change? So the question is, how do you measure exposure to climate change? For example, how do you know how much exposure the communities might have had to some of the smoke and residue from wildfires? What's the appropriate comparison group comparing indigenous communities to what? To regular members in Canada and Alaska? Recognize also that many Arctic workers are also members of the indigenous communities. What do I mean by that? It means that people who work on these big oil platforms and big mining undertakings, and even round up reindeer as they do in Norway and things like that, these workers come from the same communities that we're talking about. How do you measure exposure-response relationships? And this is really critical because for workers, they may not spend their whole lives or even a big chunk of their lives in their work routines. They may work only 6 months in the year, and they spend the other 6 months, like in the winter, in climates farther south. We don't know. There's one other thing that occurs to me, that one example of a working group that we might want to focus on would be the Coast Guard in the U.S. and Canada, because with there being a lot more open water and a lot less ice, there's likely to have been some uptick in Coast Guard activities and Coast Guard members of the military serving in the North, and that would be a very good group, it would seem to me, to examine. At least in the U.S., there's one other benefit is that Coast Guard members receive care from a variety of sources, but their military health records are all kept in one place, so it's a little easier to study than it would be the case for somebody who would be an oil drilling worker or something like that. So, last slide. I think we've come to the end, and if there are any questions, I would be more than happy to try and do so. And also, if people want to get copies of the whole slide deck, I'd be happy to share that with you with or without the presentations that I've put here today. But thank you all, especially to you, Marianne, for inviting me to speak.